Hello everyone, I Akhirul Islam, a student of Lakhimpur College of Veterinary Science. Today I shall be discussing about the topic anthrax. Now before I begin, this is the disclaimer that this presentation has been prepared by me and is a student of Lakhimpur College of Veterinary Science AU Join. Therefore the information collected by me may not corroborate with the findings of the deep research work carried out in the respective field. However, utmost care has been taken by me to provide correct information. No information of this presentation should be considered for scientific work without cross verifying the information. It has been prepared only for educational purpose and not for any commercial purpose. Further, the information in the presentation should not be used for the treatment without consulting registered practitioner. The disease is also known as splenic fever, wool sorter disease, malignant carbuncle. Introduction: it is a paracute, acute and septicemic disease of cattle leading to sudden death. The extensive enlargement of the spleen given this disease the name splenic fever. It is a zoonotic disease spread from infected animal to human beings during the processing of wool and hides. Etiology: the disease is caused by Bacillus anthracis in both animals and humans. Non-motile capsulated gram-positive and spore-forming, state very large rod-shaped, small short chain. The organism has two virulent forms. One is capsule containing polyglutamic acid, which resists the phagocytosis by the host immune cells, is coded by the virulent plasmid PXO2. And the second is triple toxin, edema factor, lethal factor 2 and the protective antigen factor 3, and these are coded by the plasmid PXO1. The special features of the organism is that the organism produces spores when exposed to external environment and can live for prolonged period outside the host in the environment. Now the host affected. Cattle and sheep are highly susceptible. Human is less susceptible than cattle. Pigs, dogs and cats are relatively resistant, but once affected, the case fatality rate is high in farm animals. Hippopotamus, Cape buffalo and elephant die in large numbers due to anthrax. Persons working in wool industries are mostly affected. Predators act as carrier for this infection. Now coming to epidemiology, the disease is distributed worldwide. The disease is reported to be recognized from sub-Saharan Africa. Prevalence depends upon the nature of soil and climate condition, that is hot, humid, which helps to forecast anthrax year. Infection is restricted to a particular area is called the anthrax belt or enzootic region. Vegetative proliferation cause outbreak of the disease. In India, the disease is enzootic. Predisposing factors: pH of the infected soil, infected wool and hides and other materials. Alkaline pH of pH 9 preserve the organism, but acid soil destroys the organism. In wet soil and in stagnant water, spores are concentrated and suspended. Blood transfusion may also spread the disease. The major source of infection are contaminated bone meal, pest food contaminated with ternary effluents, fodders grown on infected soil, turning up of soil, blood and other discharges from infected animals. The source of infection are contaminated soil, environment, infected excretion and secretion. Now coming to transmission. The disease is mainly transmitted through ingestion of spores. Inhalation of spores, which is less common in animals but more common in human beings. Contamination of wound by spores. The disease is transmitted from one place to another by water, air current and the factor like tapenet fly, which is mechanical transmission. Pathogenesis. Spores are produced from discharges and materials when exposed to air. The spores, which are resistant in the external environment. The organism is very resistant to phagocytosis due to the presence of polyglutamic acid containing capsule and triple toxin factors such as edema factor 1, lethal factor 2 and protective antigen 3. Primarily, spores proliferate in the regional draining lymph node, which then travel through a lymphatic vessel and then reach the blood stem, which causes septicemia and massive invasion into all the body tissue. The lethal toxin causes edema, tissue damage and death. Finally, the blockage of capillaries initiating death is commonly known as logjam theory, and death is due to shock, acute renal failure and finally terminal anoxia. Clinical sign in cattle and sheep: paracute form, sudden death without any premonitory sign, Upon close examination, the following signs can be seen: fever, muscle tremor, dyspnea, that is difficulty in breathing, congestion of mucous membrane. Animal collapses and die due to terminal convulsion. After death, oozing of blood from nostril, mouth, anus, and vulva is noted. That is, oozing of blood from all the nasal orifices. The picture showing on the right side is oozing of blood from nostril. In acute form, cattle and sheep shows fever, 42 degrees Celsius, severe depression, listlessness, congestion and hemorrhage of mucous membrane, increased heart rate and rapid respiration, mouth breathing due to oxygen hunger, abortion, decrease in milk yield, blood stained or deep yellow color milk, diarrhea, local edema of tongue, throat, sternum, perineum and flank occur. The incubation period of the disease varies from 1 to 2 weeks. The course of the form is about 48 hours. Clinical sign in pigs: high temperature, dullness, anorexia, distinct inflammatory edema in throat and face, painless swelling caused obstruction which leads to swallowing and respiration difficulty, blood stained froth present at the mouth, petechial hemorrhage of skin, dysentery, pulmonary form in baby pig, that is lobar pneumonia, exudative pleurisy, death in a day or two. Now, the clinical sign in horses: septicemia, enteritis and colic, painful edematous and subcutaneous swelling in throat over the lower neck, floor of thorax, abdomen, prepuce and mammary gland, high fever, severe depression, dyspnea due to swelling of throat. The course of the disease is about 48 to 96 hours. Now coming to necropsy finding, there is absence of rigor mortis. Quick gaseous decomposition results. Characteristics show horse posture. Unclotted terry-colored blood oozes out through all the nasal orifices. The spleen is soft and enlarged with a black berry-jam consistency, which is more important feature of anthrax. Suspected carcass of anthrax should not be opened before confirmation by peripheral blood smear examination. Pharyngeal form of anthrax in horses and pigs are enlargement of local lymph node, lesion in the soft tissue of neck and pharynx. Coming to diagnosis, diagnosis is based on the clinical sign and necropsy finding, the isolation and identification of organism. Hematological and blood chemistry examination should not be conducted because of the risks for humans. The microscopic examination, that is the McFadden reaction, where square-ended blue bacilli with metachromic pink capsule after staining with polychrome methylene blue stain. In early stage, bacilli may not be present in blood, so culture can be done, or the materials like infected fluid can be injected into guinea pigs would give proper diagnosis. Diagnosis can also be done through fluorescent antibody technique. Using monoclonal antibody can be done to detect the disease. Gelatin step culture. The growth resembles an inverted fig tree appearance with slow liquefaction from the top. One can see the picture on the right side is inverted fig tree appearance. Diagnosis can also be done by nutrient agar media. The 5% blood agar show medusa head colonies. And the last one is Ascoli's test. To demonstrate the antigen in severely decayed carcass and skin, the tube containing positive serum is overlaid with suspected sample. Develop a white precipitation ring at the junction of two liquid in positive cases. The disease can be differentiated from lightning stroke, electric injury, acute tympani, black water, acute lead poisoning. Lightning stroke is characterized by sudden death with singeing mark on the hairs of the stricken area. Electric injury is the history of contact with electric ropes. In acute tympani, there is history of excessive carbohydrate engagement. In black water, there is emphysematous condition of muscle giving rise to sign of crepitation. In acute lead poisoning, which is characterized by sudden death, respiratory distress, and cyanosis of mucous membrane. Now coming to treatment. Recovery occurs when the infection is identified in early stages and treated with penicillin at the dose rate of 20,000 IU per kg body weight twice daily for 3 days. One can use streptomycin 8 to 10 gram per day in 2 divided doses. IM for cattle is effective. Oxytetracycline at the dose rate of 5 to 10 mg per kg per day, IV or IM can be given. Antiserum is given daily for 5 days, however, it is expensive. And the symptomatic treatment can also be given. Prevention. The disease can be prevented by proper vaccination. Anthrax spore vaccine protect all the species of animal, that is cattle, sheep, goat, horse, ass, elephant, pig and camel. The vaccine is used in this disease and in outbreak areas. Following outbreak, the animals can be consecutively vaccinated for 3 years for the prevention of further outbreak in the region. Age at first dose is 4 months and above. Vaccination schedule of the animals, goat and sheep, where the vaccine is spore vaccine. Time of vaccination is once in a year before monsoon, which provides immunity for 1 season at the dose rate of 1 ml and the route is subcutaneous. Vaccination schedule for cattle and buffalo is same as that of goat and sheep. Now coming to control. Anthrax suspected carcass should not be opened. Plugging of nasal orifices with cotton to prevent exposure and spore formation. Carcass must be disposed by burning or deep burial. Burial should be done in 2 meter deep with adequate application of quicklime, liberal application of 5% formaldehyde to control the spread of spores. The disease can be also controlled by strong disinfection with 5% Lysol for 2 days, 5 to 10% formalin or 2% sodium hydroxide is highly effective. The disease can also be controlled by peracetic acid. 3% solution of 8 liter per meter square is considered as very good sporicide and effective sterilant. Maintain the suspected animals for 2 weeks under quarantine. Vaccination of survivors, administrations of hyperimmune serum to contact animal. Livestock and animal byproduct like meat, milk should not be taken out of the farm during the quarantine period. With the hope that this presentation will be beneficial for everyone. Thank you and have a nice day.